So I'm Raman Sankar. I'm a professor and head of pediatric neurology at UCLA. It's a very special program I'm trying to create where we're not just focusing on seizures or one side of the child's life, but the overall presentation and an assessment of all their needs and our ability to guide them with that.
You know, when a child is given a diagnosis of autism spectrum disorder or epilepsy, it can be very devastating for a family. What does that mean? What does that mean long term, 5 years from now, 10 years from now? Are they going to grow up to be a normal teenager, a normal adult? And that's really scary. I'm Rujita Bhatt. I am a pediatric neurologist here at UCLA, and I primarily focus on neurodevelopmental disorders and behavioral neurology.
Can you take your finger like this for me and touch your nose?
Rujita was specifically chosen to integrate a number of behavioral traits, neurobehavioral and neurocognitive traits, that many of which come under autism spectrum disorders, but not entirely.
It's right here like a noodle.
Along with the interaction with epilepsy.
So, neurodevelopmental disorders encompass a few different diagnoses. Autism spectrum disorder, epilepsy, intellectual disability, attention deficit hyperactivity disorder, and global developmental delay. One big aspect about these disorders is that there's a lot of overlap within them. Not only do these disorders overlap, but each child is very different. Their symptoms may manifest in a very different way compared to another child. And there are going to be a lot of questions of what does this mean? What do we look for? Dr. Jeste and others developed the Developmental Neurogenetics Clinic, and I now work as a part of that as well. And in that clinic, the idea is that there's a neurologist, myself being one of them, a geneticist, Dr. Julie Martinez, and a psychiatrist as well, Dr. Sunil Mehta. Our sole goal and purpose is to really provide that individual care for each child. That's how we incorporated these three sort of specialties. And right now, we're just at the cusp of starting to see children and provide that comprehensive care.
All right, are you ready for the electrodes? I think Maria's ready to put the stickies on you. Okay, we'll let her do that, okay? Thanks, Gordon.
Part of what we do is really take a very broad look at it, There are intrinsic problems a child's brain may have, and sometimes it may not be brain, it's some other part of the body, but it's impacting on the brain. In Blake's story, my suspicion was raised not by the EEG, not by her seizures themselves, but of the remarkable crescendoing in a very limited period of time, where she ended up in the emergency room despite rapid escalation of multiple medication. And that's when you have to say, this doesn't make sense. There has to be something else. And then we brought her in, obtained her spinal fluid, and found a relatively rare type of autoimmune disorder. Then we were able to actually focus not on the seizure, but on the autoimmune disorder. And move your eyes this way. And then when we did it right, it not only helped with seizures, it improved her motor performance and her ability to reason things. So epilepsy is really a large collection of disorders that share seizures as a common trait. Likewise, autism, we now have 200-300 genes, but we also have a lot of patients who don't have anything wrong with any of those genes.
We're starting to find certain patterns on EEG that might be leading to seizures and also might be leading to the diagnosis of autism as well. And we now know that, particularly in autism spectrum disorder, these children are at a much higher risk for epilepsy. The general population's risk for epilepsy is about 1 to 2%. And as you move to autism spectrum disorder, that risk increases up to about 30%. And that's pretty significant.
In the time I have known Blake, this is the best EEG.
Yay!
So,
It was really hard for me. I had all those hiccups in my brain. I saw Dr. St. Clair. He figured it out really quick, and he's a cool man.
As we increase awareness for these disorders, that is really important because we begin to identify children much earlier. If we start providing speech therapy or occupational therapy or behavioral therapy at 9 months of age, that can really change an entire trajectory for a child's life. So really, we're not only looking at children here, we're looking at the entire lifespan for these children.
Give you a high five for that one.
You know, seeing patients is what we love to do. But it's from seeing those patients and learning from those patients that we're able to develop possible research mechanisms to be able to better understand these disorders, better understand these children, and really provide targeted therapy for each of these children. Because, as I said, ultimately what's most important is helping them through a lifetime, not just in this moment, not just giving them the diagnosis. But how can we cure autism spectrum disorder? How can we cure epilepsy syndromes? How can we help some of these genetic diagnoses and really individually identify them and think about what they might need specifically?
for people who want to join us in this great adventure, it's a very simple thing. What we're trying to do takes a lot of time, a lot of focus, a lot of attention.
It's this funding, it's this help, it's these resources that allow us to do that.